Out of stock, out of stock, out of stock, out of stock.
Behind these numbers, a slow panic is setting in over Strep A. Community demand for antibiotics has shot up, and with it, prices.
£8 for an antibiotic, we're looking at £10 for an antibiotic. You know, that is not normally the case.
On Friday, another child died at a secondary school after contracting Strep A, while at this Oxford pharmacy there are empty shelves.
In my 10 years, I've never seen amoxicillin being, out of stock, or comaxiclav out of stock, or penicillin V for treating, let's say strep throat, Strep A being out of stock. It's never happened in 10 years. What you're saying today is that you could buy amoxicillin for, let's say 90 pence, but now you can't get it for more than £3 or £4, and it's out of stock. That's not happened in 10 years that I've been qualified. That's a serious problem.
Laura has 3 children. The eldest has Strep A. She's had to call around multiple pharmacies to try to find antibiotics.
It's just worrying, really. You just panic because you rely on these services to be able, to get antibiotics for your children, and they're not there. What do? They tell you not to go to A&E because you'd be treated out in the community, but you're forced to do to go there.
Thank you. See you then. Bye.
A raw material issue to make antibiotics overseas and supply chain COVID complications have made things difficult. Alongside that, Sky News has spoken to pharmaceutical industry leaders who say that the minute there's a shortage like this, look, these shelves in the middle are normally packed full of antibiotics, then stockholders will take advantage of this, charging whatever they like, some of them making hay while the sun shines, profiting from the enormous demand because of Strep A. The government say it's normal for prices to fluctuate based on demand. What's important is patients are still able to access antibiotics, which they are. But some pharmacies are struggling to cover costs.
A lot of pharmacies are finding it very difficult to actually pay the wholesaler's bill. So if this continues and the Department of Health and the government doesn't do anything about it, then we are going to be seeing a lot of our pharmacies shutting their doors for good over the coming months.
When do you think you're going to be able to get some back in?
No idea. No idea.
The government's working to help expedite deliveries, but as the number of children falling ill rises and more are turned away, a sense of unease is growing. Adele Robinson, Sky News.